Now the CDC is warning of a flesh-eating bacteria spreading in some of those waterways in Long Island, New York. The Vibrio bacteria can be found where fresh and saltwater mix, can also enter through an open cut or by eating raw or undercooked shellfish. Let me bring in Dr. Stephen Quay, infectious disease and public health expert, for more. He's also the author of the brand new book, The Code as Witness, on the origin of COVID-19. Doctor, thank you for your time and welcome back to the show, sir. Especially, you're on the West Coast, so it's 5:30 a.m. where you are. I'm double appreciative.
It absolutely is, but this is important, so let's go for it.
Yeah, let's chat about it. We're told that this flesh-eating infection is rare, but the consequences can be deadly, and it apparently moves extremely quick. Break down what Americans should know as they all head to the beaches for the holiday weekend, sir.
Yeah, I think mostly this is a good news story. So let's be clear on this. About 200 cases a year, 50% are in the Gulf states. So I did a little math. There's 200 million beach days a year in the Gulf states. So basically you have a chance of 1 in 2 million of getting this. As you said in the introduction, it mainly occurs in brackish waters where fresh water meets salt water. So if you're in the big waves, you're not going to see it. 90% of the time, it's a wound that you have that isn't covered when you go in the water and it gets infected. 10% is eating oysters that have it. And so I think the way to think about it is, look, we've all had wounds, we've all had cuts. When you get a cut that's infected with Vibrio, it's going to hurt more than any cut you've ever had. It's going to swell up more than ever. It's going to change colors. You should go to the emergency room. You should find the first doctor and say, hey, I think I have a Vibrio infection. Now, if they look confused, just say, hey, well, you guys should be watching NewsNation.
Yeah.
Now, go off and find out what drug I should have, because it's easily treatable. It's 100% treatable if you get it quickly.
Okay.
But it's 20% fatal if you don't go to the doctor quick enough.
Yeah, it sounds like you'll know pretty quickly whether you've got something wrong or not. And so you're not sounding the alarm because this is so rare. So what does that mean for weekend plans? You're still telling people, go swimming at the beach, that's fine.
Yeah, absolutely. So, I mean, again, it's not going to happen where there are big waves at the ocean. It happens, where a river is meeting the ocean. The water is still. So if you're wading around and the water was still with a wound, you should put on, a waterproof dressing for the wound. But otherwise, enjoy this 250th anniversary weekend and God bless America.
And God bless America. And so the main risk group, is that mainly people with open cuts or people with underlying conditions more at risk here?
90% is open cuts, 10% is eating oysters that happen to have it. And it does follow, people with risk factors like cancer and those sorts of things. It really likes iron. So people with liver disease have increased iron. So they're at about a 3-fold increased risk of getting it.
There's also some new reporting linking this to federal cuts that have been made. CDC's FoodNet program, which tracked Vibrio across 10 different states, just made that kind of tracking optional last year rather than mandatory. Are you seeing any sort of link there between this and those cuts?
Yeah, I've looked at it pretty carefully, and I don't. All of the states, all of the states along the eastern seaboard have a program from May to October where they have a sort of an infection reduction program in the oyster farms with various aspects. So if you can still get it in a restaurant, but it's more likely for, finding your own oysters.
Okay. And I'm allergic to shellfish, so I'll steer clear of Vibrio that way this weekend. Dr. Stephen Quay, thank you for breaking this all down for us, and happy 4th of July to you and yours, sir.
Same to you. Thank you.
We'll see you back here soon.